It was a night like any other in the ICU. Controlled chaos, the kind we thrived in. The monitors were beeping, the air was thick with antiseptic, and the fluorescent lights buzzed faintly overhead. I was at the nurse's station charting when the alarm went off. "Code blue, room 312, someone shouted. I bolted down the hallway, my sneakers squeaking against the polished floor. When I burst into the room, Mr. Thompson was convulsing, his face pale, his chest heaving. The monitor showed his heart rate plummeting. "Start compressions!" I yelled, adrenaline surging through me. The team sprang into action, except for her, Sarah, the new nurse. She stood frozen by the door, her eyes wide, her hands trembling. "Sarah!" I barked. "Get the crash cart!" She didn't move. She just stared at me like a deer in headlights. "Now!" I screamed. Finally, she stumbled toward the cart, fumbling with the defibrillator paddles like she'd never seen one before. My stomach twisted. Something was wrong. The monitor flatlined. We lost him. I looked at Sarah, my chest heaving, my hands shaking. She wouldn't meet my eyes. That's when I knew. Something was terribly wrong with her. But that wasn't the first time I noticed something off about her. Let me take you back to the beginning. My name is Lisa, and I've been a nurse in the ICU for over 15 years. I've seen it all, miracles, heartbreak, and everything in between. But nothing could have prepared me for what happened with Sarah. It started a few months ago when we were short-staffed. The hospital hired her to fill a sudden vacancy. She seemed eager, maybe a little nervous, but that's normal for a new hire. At first, I thought she just needed time to adjust. But as the days went on, I realized it wasn't nerves. It was something much darker. The ICU is no place for hesitation. Every second counts. We're a team, and we rely on each other completely. When Sarah joined us, she seemed off. She was polite, almost too polite, like she was trying to blend in. She avoided personal questions, gave these overly rehearsed answers about her experience, and never joined us for coffee breaks. I remember one day, during rounds, she couldn't find the saline flushes. They're in the same place in every room, but she acted like she'd never seen an ICU supply cart before. I brushed it off. Maybe she was just having an off day. But then there was Mr. Thompson. He was one of our critical patients, but stable. I remember thinking, he's in good hands. I didn't know how wrong I was. The red flags started piling up. One night, I caught Sarah Googling how to perform a central line insertion on her phone during a shift. I confronted her, and she laughed it off, saying, "Just brushing up on my skills." Then there was the medication error. She gave a patient the wrong dosage of insulin. When I pointed it out, she shrugged and said, "Simple mistake." But it wasn't simple. It could have killed someone. I started asking around. Some of my colleagues thought I was overreacting, but others admitted they'd noticed things too, like how she avoided high-pressure tasks, or how she always seemed to be busy when something critical was happening. And then came the night with Mr. Thompson. It was late, past midnight. The ICU was quieter than usual, the kind of quiet that makes you uneasy. I was at the nurse's station when I heard the alarm from Mr. Thompson's room. I ran in and found Sarah standing by his bed, her hands hovering over his chest like she didn't know what to do. His oxygen levels were dropping fast. "Sarah, what's going on?" I demanded. She stammered. I don't know. He just..." "Step aside," I snapped. I checked his IV. She'd set the wrong flow rate. His veins were collapsing. "Get the crash cart," I ordered. She froze. "Sarah!" I shouted. "Now!" She stumbled out of the room, and I started compressions. My arms burned, my heart pounded, but I couldn't stop. The rest of the team rushed in, and we worked together, but it was too late. The monitor flatlined. I stood there, drenched in sweat, staring at Mr. Thompson's lifeless body. My hands were shaking. My chest felt hollow. And then Sarah walked back in, empty-handed. "Where's the crash cart?" I asked, my voice low, dangerous. She looked at me, her face pale, her eyes wide. I couldn't find it," she whispered. I lost it. "You couldn't find it? Are you kidding me? What the hell is wrong with you?" She started crying, her shoulders shaking. "I didn't mean for this to happen," she sobbed. "I'm not even supposed to be here." The room went silent. "What do you mean, you're not supposed to be here?" I asked, my voice barely above a whisper. She looked at me, tears streaming down her face. "I'm not a nurse," she said. "I faked everything. I thought I could learn on the job, but I can't do this." I felt like the floor had been ripped out from under me. My ears were ringing. My hands were numb. You're not a nurse," I repeated, my voice shaking. She shook her head, sobbing. "I'm sorry. I'm so sorry." I've replayed that night in my head 1,000 times. The signs were there, but I ignored them. I told myself it was just nerves, that she'd get better with time. But in this job, there's no room for doubt. Lives are on the line. I still wonder, how many more Sarahs are out there, slipping through the cracks?